Hello everyone, today we're going to talk about aseptic techniques, how we keep procedures clean and safe. Aseptic technique means preventing contamination during any medical procedure, protecting both the patient and the healthcare worker. Let's start by learning what aseptic technique really means and why it's important. Before we start, let's look at our main objectives for this session. By the end of this lesson, you'll be able to understand what aseptic technique means, learn the key principles that guide safe practice, explore real examples in clinical or lab settings, and identify common mistakes and how to avoid them. Let's begin by defining what aseptic technique really is. Aseptic technique means a set of practices to prevent contamination from harmful pathogens. The goal is to protect patients, healthcare professionals, and sterile equipment and environments. We use aseptic technique in many situations, such as surgery, wound care, injections, and lab procedures. In short, aseptic technique keeps every procedure clean, safe, and infection-free. Here are the key principles of aseptic technique, the rules that keep every procedure clean and safe. 1. Always assume contamination is possible. Stay alert, even a small mistake can break sterility. 2. Sterile to sterile is safe, but 3. Sterile to non-sterile means contamination. Once something sterile touches a non-sterile surface, it's no longer safe to use. 4. Minimize air movement in talking, droplets can carry germs into the sterile field. 5. Proper hand hygiene is essential before, during, and after the procedure. 6. Never turn your back on a sterile field, because you can't see if contamination happens. 7. Use PPE appropriately, gloves, mask, and gown protect both you and the patient. These principles are simple, but following them consistently saves lives. There are two main types of aseptic techniques. Medical asepsis, also called the clean technique, focuses on reducing the number of microorganisms, for example, hand washing, wearing gloves, and cleaning surfaces. Surgical asepsis, or the sterile technique, is used to eliminate all microorganisms, for example, during surgery, catheter insertion, or dressing sterile wounds. In short, clean technique prevents contamination, while sterile technique completely avoids it. Hand hygiene is the most critical step in preventing infection. We should use alcohol-based hand rub or soap and water, depending on the situation. Perform hand hygiene before and after patient contact, putting on or removing gloves, and after any contact with body fluids. This simple step protects both the patient and the healthcare worker. Clean hands truly save lives. PPE, or personal protective equipment, protects healthcare workers from exposure to infection. It includes gloves, masks, gowns, and eye protection. PPE should always be selected based on the level of risk. For example, a mask and gloves may be enough for routine care, but for procedures with splash risk, we add gowns and face shields. The goal is simple: protect yourself first, so you can safely protect your patient. Maintaining a sterile field means protecting the area from contamination. Remember, only sterile items should be in the sterile field. The 1-inch border around the drape is considered non-sterile. Do not reach over the sterile area, and avoid unnecessary movement or talking, because air movement and droplets can easily carry germs. Once the sterile field is contaminated, it's no longer sterile. Always start over to protect patient safety. Aseptic technique is not only for surgery, it's used in many daily clinical procedures. For example, catheter insertion, either IV or urinary. Surgical operations and central line dressing changes. Wound care to prevent infection. And in laboratory work, like culturing or media handling. No matter where we are, ICU, ward, or lab, the same rule applies: maintain sterility to protect the patient. Even small mistakes can break sterility, and once contaminated, we must start over. Let's review some common mistakes to avoid: touching sterile items with bare hands. contaminating gloves or gowns by touching non-sterile areas. Turning your back on the sterile tray, you lose visual control. Forgetting hand hygiene before or after the procedure. And using PPE incorrectly, such as reusing gloves or improper mask fitting. Remember, aseptic technique is not just skill, it's awareness. To maintain high standards of aseptic technique, we must build good habits through best practices. Train regularly, skills fade if not practiced. Follow checklists, they ensure nothing is missed. Use sterile supplies, never reuse single-use items. Audit compliance, regular monitoring keeps everyone accountable. Maintain a clean environment, sterility starts with cleanliness. When we combine knowledge, practice, and teamwork, we create a safer space for both patients and staff. In summary, aseptic technique is the foundation of infection control. It includes everything we've discussed today: hand hygiene, PPE, sterile field, and above all, discipline and awareness. Every time we follow aseptic principles, we protect our patients, our colleagues, and ourselves. Let's make it a habit, because aseptic technique saves lives. All the information in today's session is based on trusted global standards, including the WHO guidelines on hand hygiene, the CDC infection control guidelines, and clinical practice textbooks used in nursing and medical education. Following these standards keeps our practice safe, consistent, and internationally aligned. Thank you everyone for your attention and participation today. Remember, aseptic technique is not just a procedure, it's a responsibility we carry every day to protect our patients and ourselves. Let's keep working together to build a safer hospital for everyone.